An 80 years old woman with a hip fracture, her calcium level is normal. She never been given diagnosis of osteoporosis. Apart from treating the hip fracture, what additional intervention should be considered? So the patient not suffering from the osteoporosis, calcium level is normal. But apart from treating the hip fracture, that means hip fracture develop, what should be, we should give the supplement, the vitamin D and calcium supplement alone, vitamin D, calcium supplement and bisphosphonate, vitamin D alone, calcium supplement alone, and dexascan. So let's see how it is the normal bone and the osteoporosis. In normal bone, there is the broad area of the trabecula. Here we can see these the trabecula, and the trabecula is usually thick, but in case of osteoporosis, the trabecula, they are become thinning and big hole is forming in this trabecula because the calcium and phosphate, they are removed from the osteoporotic bone. In this picture also we can see this is the healthy bone. In healthy bone, this is the normal architecture. That means here the holes are very small and trabecula very thick. But in case of second picture, here we can see these the trabecula, then this trabecula become gradually thickening, and it is responsible for weakening of the bone and finally development of the pathological fracture. Now see the treatment of the osteoporosis. First of all, the fracture are treating according to the site and mechanism of injury. That means first of all, we should give focus on the fracture and management of the fracture, because the fracture develop in older age due to osteoporosis. So osteoporosis we have to address, or we have to find out is there any osteoporosis or not. And drug, what are the drugs are the calcium and vitamin D, both are acting very actively. Then bisphosphonates such as the alendronate, ibandronate, risendronate and zoledronate. So the calcium, vitamin D and bisphosphonate, they are supplied, and sometimes non-bisphosphonate also given, and including the hormone replacement therapy. So sometimes there is hormone replacement therapy also given, but in case of hormone replacement therapy, there is a risk of development of the heart disease and carcinoma of the breast. So for this condition, usually hormone replacement therapy avoided. Individual at risk of fragility fracture should also be considered for prophylactic medical treatment. That means a patient suspected for pathological fracture, that means very small fall or very in less trauma is there is fracture, in this condition we also give the prophylactic treatment. So our patient, it is she is 80 years old, blood calcium normal, but never diagnosis osteoporosis, but there is a hip fracture. That means it is the pathological fracture. So as it is the pathological fracture, so we should give treatment for prevention of the further pathological fracture. So for this condition, and as the patient is 80 years old, actually there is osteoporosis present and never diagnosed because the patient never went to a hospital. So we should give vitamin D and calcium supplement and also the bisphosphonate. Here we can see the calcium level normal, but why we can giving the calcium? This is very important. First of all, let's see the blood calcium or blood parameter of the calcium is normal. Let's say this is a blood vessel, this blood calcium is normal, but the bones, suppose this is bones, what occurs in those bones, this normal calcium is maintained by removing the calcium from the bone. That means the bone become fragile, and maintaining the normal calcium is the blood, because the calcium, it plays very important role in our body regarding the different type of activity, including the blood coagulation, membrane potential, the different activity. For this condition, the calcium level should be maintained in normal position. So for this condition, the bone are destroyed and blood calcium parameter is normal. This calcium is normal, that means the blood calcium is normal, but there in the bone calcium is hugely reduced, and finally the bone atrophied, osteoporosis develop, bone length decreases. So now what we have to do, we have to give the calcium supplement, and finally the calcium goes to the bone, and again the prevention of osteoporosis and treatment of the osteoporosis when done, then the length of the bone also increases. So vitamin D, first of all give vitamin D. Second one is the calcium. So calcium directly goes to the blood, then to the bones. But what the vitamin D acting? The vitamin D, it reabsorb calcium and phosphate from GIT. Calcium and phosphate from GIT. That means the gastrointestinal tract. So it absorbs the calcium from the gastrointestinal tract, and also it given to the blood. So in the blood there is two important source. One is the direct calcium, another one is the calcium from the diet. For this condition, vitamin D, calcium and bisphosphonate supplement should be given.